This month, the American Cancer Society joins with our global partners to mark International Women's Day on March 8th. Although tremendous strides are made each year to protect women's rights and women's health, we know we can do better. While global health agencies, the United Nations, governments, and the private sector are stepping up to offer much-needed resources on women's health, these efforts, for the most part, do not include cancer and other non-communicable diseases, which account for about 65% of global deaths among women. The International Agency for Research on Cancer reports there were approximately 6 million new cases of cancer in women and 3.3 million cancer deaths in 2008, and the numbers are projected to nearly double by 2030. Lung, breast, and cervical cancers cause more deaths in women worldwide than HIV/AIDS. This is a tragic and largely avoidable situation. As we know, in Western countries, cervical cancer is mostly preventable and treatable through early detection, and yet it is the fourth leading cause of cancer death among women globally, and the leading cause of cancer death among women in Sub-Saharan Africa, South Central Asia, and Central America. Developing countries bear the brunt of this disease. Incidence rates remain high in developing countries, where girls and women do not have access to prevention services such as Pap tests or vaccines against the human papillomavirus or HPV infections that cause cervical cancer. Fortunately, the Global Alliance for Vaccines and Immunizations, known as the Gavi Alliance, is developing a plan with partners to support funding for 9 developing countries to receive HPV vaccines. This is life-saving news welcomed by the American Cancer Society, Cervical Cancer Action, and our partners in the Women's Task Force on Non-Communicable Diseases and Health. Women around the developing world are also faced with rising rates of breast cancer, which is the most frequently diagnosed cancer in women worldwide. About half of these cases occur in economically developing countries, and breast cancer is the leading cause of cancer deaths among women globally. Some progress has been made to reduce incidence rates in Western countries, but there is an urgent need to translate these interventions into the developing world, where rates are escalating. Women's cancers are taking aim at mothers, wives, daughters, and sisters, and are devastating families. As the world's leading voluntary health organization, the American Cancer Society stands with our global partners to demand better for women around the world. This week, we ask you to join us to amplify our message. Visit global.cancer.org to read about brave women around the world who have battled cancer and are now becoming advocates to stop this disease from ruining families and taking lives far too early. You can also share your own story on our website, as well as the ACS Global or More Birthdays Facebook pages. As a cancer survivor, I am personally inspired by the courage and willingness of women who have shared their empowering stories and turned them into a positive force for change. Together, we can and must continue to make the case for global action to create a world with less cancer and more birthdays.